I just wanted to thank you all for coming. We had been here once before, and it was wonderful. Facial feminization is a spectrum of plastic and reconstructive procedures, ENT procedures, neurosurgery procedures, oral surgery procedures, and as you can imagine, with so many different specialties coming into play, it's complex. And so, you forward one slide. So what is facial feminization surgery? It's a type of surgery which is nebulous in that it has a lot of different components to it, but the goals are pretty clear. It's to demasculinize features of the face and to create a more feminine appearance. We're going to go over the procedures today, but they're not necessarily procedures that are just known to facial feminization surgery. They're procedures that are known in plastic and reconstructive surgery, ENT, cosmetics, neurosurgery, and oral and maxillofacial surgery. This is one of our patients here who we actually did surgery on, and we'll go over some of the procedures we did. Next slide. So when you look at a face, we kind of see faces and we kind of deem them masculine or feminine based on certain characteristics. And they're not set in stone, guys. It's just as plastic and reconstructive surgeons, we try to look at proportionalities and measure people and look at anatomy and cadaver labs and come up with proportions that are more masculine versus more feminine, and it's changed over many years. So it's not set in stone, but we split the face really into thirds. So the upper third involves the hairline, the brows, the frontal bone. The middle third involves the eyes, specifically upper eyelids, lower eyelids, the nose, and the cheeks. Where the nose ends, the lower third of the face begins, and it's really the lips, the jaws, the chin, and the neck. And there's procedures that you can do for each part of the face to feminize the face depending on what you're given. And so the cool thing about facial feminization surgery is there's no one standard procedure that you do with a patient that's going to make them reach their goals. Okay, next slide. So the upper third, let's talk about the upper third, hairline and brow lifts. So when trans women have approached us in our office, the goal for the hairline and the brow lift has typically been a complaint that their hairline may be retrusive, maybe further back, and they want to move the hairline forward. The brow bone above the eyebrow may be protrusive, and that's more masculine. Also, the lateral aspect of the brow may be ptotic, whereas when you look at men, maybe their eyebrows are more flat. And we've seen makeup artists and women change that effect with eyeshadow or how they cut the eyebrow. And so depending on the patient, you may want to lower the hairline, you may want to raise it, and whether you do a hairline advancement or do a lift to pull a hairline back really depends on the patient. But usually for more feminine appearances, you want a forehead of about 6 centimeters, which tends to be more feminine. A larger forehead at times tends to be more masculine, but it varies with patients. So there's no strict rule per se. Patients will complain about frontal bone bossing, where they have really prominent frontal bones. And so during this procedure, we go in through the hairline, we go all the way down to the bone, and we can burr the bone, or sometimes we have to take it off and bend it and put plates on and make the area flat. Next slide. At the same time, when we're doing that procedure, we have the ability to pull certain parts of the forehead up to make the brow above the eyelid more advanced and look more feminine. So there's two methods here, and what you're seeing on the left side is a craniofacial resection of the bone. And what we do is we go in with saws and drills, and we cut the bone, elevate it, and then what they are not showing here is we take different instruments to bend the bone, guys. And that allows us to flatten the bone or curve the bone a little bit more to make a more feminine appearance. We also, if it's not terribly protrusive, what we can do is on the right side, we can just outline the area we want to burr with a shaver, and we just shave it down. At the same time, we can pull the skin back up and kind of reposition the eyebrows, and also pull forward the hair so that the hair doesn't seem so far back. Okay, so that can give a more feminine appearance to it. Next slide. So the next area we wanted to talk about are the mid-face. So we talked about the upper third, and now we're going more to the middle third. There is a slew of procedures you can do in the mid-face, from fat grafting the cheeks to make the cheeks more fuller, which you see on the right side. Fat is our friend now, because fat can do amazing things to make wrinkles look less prominent, and also to give fullness that we lose with aging. And so making a more youthful face is feminizing, but it also, to some degree, can be used in masculinization techniques too. So I don't want to tell you, oh, fat grafting is just to make you look more feminine. It's not, because there's tons of patients who lose fat for many different reasons, HIV, and aging, nutritional deficits, who fat can replace and give a more youthful appearance, and that can feminize the face. It can also masculinize the face depending on the patient. The areas that we concentrate on in the mid-face are the upper eyelid, the lower eyelid, the nose, and the cheeks. So what makes a patient more feminine is more youthfulness, and we use fat under the eyelids, sometimes in the tear troughs, to get rid of the bags in the area, or we fat graft the cheeks. We also look at the skin, and for some of our older patients who are transitioning, the skin is redundant and it has wrinkles in it, and there's techniques called blepharoplasty where we can take those skin out. We can also put volume there by taking fat from other areas in the body and placing fat under the eyelid. The lower eyelid, same thing. Sometimes there's excessive skin and there's what we call fat bags, and we have to reposition the fat. And you can see a nice picture of that at the bottom, where the lower eyelids have been treated with repositioning of the fat and tightening of the skin. Okay, next slide. Also, a big component of facial feminization is of the mid-face is the nose. So we're in LA, we see a lot of rhinoplasty, we do rhinoplasty, and so a lot of patients want a nose that's not bulky on the tip, not wide, and doesn't have a parrot-looking appearance, And so, could you say that that's a facial feminization surgery only? No, right? That's a cosmetic surgery too, but it does make the nose look nicer, and in general, larger noses are more acceptable on men. Though in LA, even men sometimes don't want a large nose. So, but this is a patient here who came in who had actually needed two things done. Not just that she needed, and this is a trans girl who needed rhinoplasty, but also had difficulty breathing. And we addressed both at the same time. She had a deviated septum, which we fixed. You can see all the way up to the left is the side view, and you can see all the way down on the left is the worm's eye view. So you can see on the worm's eye view how bulky her nose is and how deviated her septum is, to the point where the left nostril is being occluded. So that was We kind of did the procedures to make her nose look better, just pro bono, but we got insurance approval to do her nose based on the fact that she couldn't breathe. So we just added that on, and she was very happy. So we made the nose a little smaller, we raised the tip, we readjusted the septum, and you can see on the worm's eye view all the way at the bottom now the new nose that occurred. And so this is a powerful technique, and there's volumes of books written about rhinoplasty that I could talk about forever, but it's too much to discuss. But at the bottom line is we address feminization in the mid-face by making noses smaller, making them more symmetric, making the tip more sharp, or taking away the dorsal hump like this patient had, and sometimes also addressing nostril flaring at the base by taking away excessive skin to make a smaller, more prettier, more anatomically symmetric nose. Okay, and frequently this is a part of the surgeries we do when we do facial feminization surgery.